Okay, this chapter is chapter 12, and it's talking about restraint alternatives and safe. Okay, restraints were once thought to prevent falls, but actually, research has shown they actually cause the falls because the person is going to try to get free of the restraints, and then the injuries that were occurring were more serious from falls than by a person who was unrestrained. So, they were also used to prevent wandering or interfering with treatment in the past, and they were often used for persons who were confused or had poor judgment, or maybe they had a behavior issue, and they were often restrained. Older persons were more restrained than younger people. So that's a kind of a little bit of history. Um, but that has been, with the research, that has been kind of the restraints part is really done away with. Try all other attempts before you actually restrain. So, and there are some people who need extra protection, So every attempt is made to protect the person without using restraints. But restraints can and are used only as a last result to protect the persons from harming themselves or others. So OBRA and CMS, the FDA, and the Joint Commission, state laws, and accrediting agencies all have guidelines about restraint use, and whichever one is the most restrictive is the one that the state will go by. Like if the state law, and state laws are never as are the state laws won't be any less restrictive than the federal laws. So but they can be more restrictive than the federal laws. And so, whatever the state law is that's usually what the facility is going to follow. They are whoever has the most restrictive. That's the one they're going to follow if they are getting accreditation. Um, they do not. None of these regulatory agencies or accrediting agencies forbid the use of restraints, because there are times when we actually do have to use them. But they do require trying all other appropriate alternatives first. Okay. And every center that you go to, whether or clinic you go to, whether it's a hospital, where it's a long-term care facility, or assisted living, all have policies and procedures about restraint usage. Now, you're going to hear there's different types of restraints. Okay, so the terminology that you need to hear are physical restraint. Now, physical restraint is any manual method to some form of material like a vest or a soft belt or a wrist restraint or an ankle restraint. Those are physical restraints. They go on the body and they basically restrain a body part, okay, or the person from moving. A chemical restraint is different. That's a drug, okay. Um, Chemical restraints can be, um, there's a lot of different types of chemical restraints. um, but we uh, and sometimes they still use the psychotic the psych drugs. This is when they're talking about chemical restraints, but Benadryl could be a chemical restraint too if it makes you a person sleepy and it keeps them in bed at night. Then technically that could be considered a chemical restraint. So all you have to know is, what does it mean? A physical restraint is something that physically restrains the person, like the soft belt, the vest, the ankle, or the wrist restraint, whereas a chemical restraint has to do with the drugs. Then you have freedom of movement. We all are supposed to have a freedom of movement so that we can move around when we want to. And the restraint, so we always use the least restrictive restraint so that we can promote freedom of movement. So maybe the person has to use a soft belt when in the chair, but we don't tie down their hand. Okay, so they have freedom of movement for as much as possible. And then the physical restraints have to be removed easily. Now, if a person, like we might use a safety belt in a wheelchair Now, a safety belt, if the resident can't take it off themselves, it's a restraint, okay? Because they can't operate it. But if I use a safety belt in a wheelchair and she can undo the safety belt, it's not a restraint. Okay, so there's these definitions of what is a restraint versus what isn't a restraint. It's not a restraint if the person can remove the piece. Now, if you put a jerry chair top on, I've never seen a resident yet who can move the jerry chair table off, because just the way it's positioned on the chair, they wouldn't have to know where the button is. They'd have to know they can push it and push out at the same time. I've never seen them do it. Now, they've slid out of a chair before, but not, uh, they can't remove the top. A jerry chair with a tabletop on it is really a restraint for them. So if you put someone in a recliner and you tilt them back, if they can't feel or find the operating handle on the side or have some way to put the chair up in its upright position, it's a restraint. Okay? So there's lots of rules here that you have to kind of know what is a restraint and what isn't a restraint. But they have to be able to operate it for it not to be a restraint and get it off easily. So CMS rules actually protect a person's rights and their safety, and restraints again can only be used to treat a medical symptom or for the immediate physical safety of a person or of others. And then the less restrictive measures, and when less restrictive measures fail to protect the person or others. Um, when a person gets restraints on, then you may be involved, as well as the nurses involved, in monitoring them, because they're usually monitored every 15 minutes. Um, and then you have other duties to do. So when a person does have restraints on, then a lot of work goes into it, a lot of documentation goes into it, and then restraints have to be continued at the earliest possible time. That's another key one. They have to be discontinued at the earliest possible time. So know the differences, and you can use your book as a resource there if I didn't explain it well enough. So until the late 80s here, restraints were thought, and you've already heard me kind of tell you the history here, but they can cause death. So alternatives, often, again, when we have a behavior going on, again, it's a way for the person to communicate. It may not be the way we want them to communicate, but it is a form of communication. So knowing and treating the cause of what's occurring, the behavior or causing the behavior, can prevent restraint use. Um, and restraint alternatives, again, are identified, and that's through the assessing process that the nurses use to find out a causative factor of what is the root problem here, what's causing this. And then again, it all is part of the plan. If restraint alternatives don't protect the person, the doctor may need to order, I'm sorry, if restraint alternatives do not protect the person, then the doctor may need to order restraints. So again, they can be used, but we'd really try to limit the use as much as possible. And I got to say, for long-term care facilities, are doing a pretty good job in this area. You know, they really are. Um, all centers, we've already kind of talked over this again, but you can read this line, but restraints are not used to discipline a person or for the staff convenience, and that's why it's underlined that we don't use restraints for those reasons. Um, So here now it goes into physical restraint. It's any manual method, physical or mechanical device, material, or equipment that is attached to or next to the person's body. So even a side rail can be a restraint. Restricts freedom of movement or access to one's body, and it cannot be easily removed by the person. Chemical restraints, again, are drugs. Okay, we're talking about drugs here. They control behavior or they can restrict movement. Now, all psych drugs, I tell you, are sedating. So the person is stays in a little bit of a sedated state. It doesn't mean that they're not necessary. It's just that we have to show that we've reduce this type of restraint as much as possible and still maintain the patient's quality of life. It is not a standard treatment for the person's condition. Complications of restraint use, of course, injury. That's the main thing because the person's trying to get free. Um, and injuries can also occur if we use the wrong restraint or if it's applied incorrectly or keeping it on for too long. The most serious risk is death from strangulation. But it also has mental effects on the patient as well. The Safe Medical Device Act is if a restraint causes an illness, an injury, or death, we have to make a report, and CMS requires the reporting of any death that occurs while a person is in restraint. So, just to let you know, that is out there and that we follow it. As far as legal aspects, restraints have to be, if they're put on, they have to be there to protect the person. A written doctor's order is required. Now, that doesn't mean I have to, if I'm at the long-term care facility and I've got a person who is hurting someone else and I need to restrain them, that I can't do it right then. I can do it, but I've got to call that doctor and get an order. So you might see that sometime, that the restraint is actually put on before the order is obtained, but the order will be obtained because that's part of restraints. A written doctor's order is required. Then that least restricted method is used. When we do have to restrain someone, we use the least restrictive method. Um, Restraints are used only after all the other measures fail to protect the person. If they're restrained and the protocol is not followed, it's considered false imprisonment of a person. And also informed consent is required. And a lot of times we do have to talk. You got to talk to your families. Get them families involved and talk to them and let them know what's going on. You don't. That's not really your responsibility as an aide, but sometimes you get asked questions by the family. And you'll find out who um, if you're not sure, always refer them to the nurse and let the nurse talk to them because their job. Okay. The least restricted method basically allows the greatest amount of body movement or access possible. Some restraints attach to the person's body or to a fixed, which is a non-movable object. It will restrict freedom of movement or body access. Now, this is when we get into the different types of physical restraints, like a vest or a jacket, an ankle, wrist, hand, and some belt restraints are just examples of it. Now, other restraints that are near but not directly attached to the person's body would be like bed rails or wedge cushions. Okay. They partially restrict freedom of movement, but they still will allow some access to certain body parts and are the least restrictive. Okay. Let me go back here. When restraint application. Okay. When you are applying a restraint, make sure that you use the restraint that's been ordered. So we don't use anything like a sheet or towels or tape, rope, straps. Nothing like that is used for a restraint. Um, you have to know how to put on the restraint, and we'll go over the different restraints and how to put them on, and how to also tie them to the non-movable object. If it's in the bed, it's going to be to the bed frame. If it's in the wheelchair, it will be to the wheelchair frame. It's never to the arms of the wheelchair or anything like that, but we'll go over that. And you have to follow the manufacturer's instructions on the restraint. Um, you don't use restraints to put a person on a toilet. You don't use a restraint to position them on furniture. Um, and you have to follow the center's policies and procedures for your restraints. So if you're not familiar, you get someone to help you out. So safety measures for the restrained person, again, observe for any increased confusion and agitation. Now, sometimes restraints usually do cause increased agitation because they can't get up, they can't get out, they can't move. Um, So, and if they're already in agitated state, this will just probably increase it. So that's why they have to have the monitoring. And sometimes we have to put someone with the person. We just can't even leave them alone if we can't get a family. Well, that's why we try to get the families involved. Not only do they have to be informed, but we want them there because sometimes they can uh, have a greater effect on the person than we can. Um, let's see. You have to observe the person at least every 15 minutes or more often as required by the care plan. And then the restraint and has to be removed every 2 hours, at least every 2 hours, so that the person can be repositioned. And then, of course, toileting or any type of basic needs that need to be met at that time. And then follow the care plan. So make sure you remove the restraint, observe the person at least every 15 minutes. Now, when we use restraints, we have to do a lot of documentation. Even you will have to do some of the documentation. But when we do, we have to say what type of restraint has been applied, what body parts or parts that are restrained, the reason for the application, safety measures taken, the time you applied it, the time you removed it, the person's vital signs, what care was given when the restraints were removed. We have to document skin color and condition. So if you've got a wrist restraint on, say, the left wrist, then you've got to be looking at that left hand to see is there any color changes. Or any type of changes in the nails or anything that would show that maybe circulation is being cut off. Condition of the limbs, the pulse felt in the restrained area, changes in the person's behavior, complaints of a tight restraint or difficulty breathing, pain, numbness, tingling, any of the restrained part, anything that's abnormal. All these have to be reported to these complaints have to be reported to the nurse immediately. And sometimes you are part of that. As far as restraint application, most restraints are made of cloth or leather. We do have leather, but mainly they are used in like the psychiatric hospitals. Okay, the ones that you see in long-term care facilities are made of cloth. Restraints can increase confusion and agitation in persons with dementia. They already have thoughts in their mind that they need to go somewhere or that someone is looking at them. And then if you restrain them, then it just really does their agitation. Never use force to apply or ask a coworker to help you if you have to apply a restraint. Um, it's always best to have another person with you anyway. Somebody can be talking and diverting the person's attention, um, because if they're agitated enough, then they become physical with you. Remember, the more agitation at that the behaviors are going to escalate. Okay, so what goes from like maybe wandering to be going to verbal, from verbal, it goes to physical, and so on. It just keeps escalating, escalating, escalating. Wrist restraints, which are limb holders, limit arm movement. Hands are placed in mitt restraints. This keeps them from like pulling out tubes. Um, Belt restraints are used when injuries from falls or risk or for positioning during a medical treatment with the soft belts. There's other type of restraints, uh, the vest and the jackets. Leather restraints are usually only applied to the wrist and the ankle. Wrist restraints are used when a person tries to pull out tubes used for life-saving treatments, such as an IV tube or a feeding tube. Um, Restraints also prevent finger usage because, again, it's a mitt. So once you put them in there, so we have to allow for hand, wrist, and arm movements. So you can move your hand like back and flex it, and you can do the abduction and all, but you can't use your fingers. So restraints basically keep you from using your fingers. Doesn't prevent you from using your arms. And believe you me, you can use restraints on people, but they are very good at working their way out of them if you give them enough time. So that's why, again, that's another thing why we have to monitor them is that they're going to get them off. Belt restraints, they prevent a person from getting out of bed or out of a chair. The roll belt, that's used when the person's in the bed, and it will allow them to turn from side to side or sit up in the bed. So it's basically help to keep them in the bed, but they can still turn. The belt's applied around the waist, and then it's secured to the bed frame. If it's in the chair, it's secured to the chair. There's also the safety belt or the lap belt. We also use that. It's applied over a garment. Now remember, if they can take it apart, it's not a restraint. Um, let's see. And then it talks about, in this slide, just talking about the different restraints. Like the vest of the jacket, they're applied to the chest area. And the opening will be in the back. For the vest restraint, the vest crosses in the front. The jacket is the opening is in the back. I think I have one of each for you all to look at. Um, the straps of the vest and jacket restraints always cross in the front. They never cross in the back, and they're always applied over a garment. We never put the restraints on the vest restraint or the jacket restraint over on bare skin. Okay, it's always over the clothing. Again, every restraint has a life-threatening risk, and death again can occur from strangulation. And here's some different types. Like this here is a tabletop over the wheelchair. If she can't get it off, it's a restraint. This is a wrist restraint. This is a vest restraint. This is the mitten. Okay, so again, when we do apply restraints, that lessens the person's dignity, and we want to get it off of them as soon as possible. We just want to protect them or protect the others until we can get those behaviors or whatever is causing that behavior under control, find out what it is and how can we best help the person. Always treat them with kindness, caring, respect, and dignity. And that takes care of this particular uh, chapter 12 of Restraint Alternatives and Safe Restraint Use. Mm, And I think your book shows you some different ties and of how to tie to the immovable objects, whether it's the bed frame. And I believe that's on page 167 of how to tie the Posey quick release. You might want to re read over that. I'm going to try to show it to you but it's been a while since I did a restraint, so we'll see about that. But I'll show you. It's a quick release. It's pretty easy, but it's also necessary because if you have to get the restraint undone, you want to be able to pop it as fast as possible. So there is a certain way that we're going to do it to keep them safe. Okay, and we will go on to the next chapter. Talk to you in a little bit.